Tom Simon is the Associate Director for Science, the Division of Violence Prevention at the National Center for Injury Prevention and Control. As the Associate Director for Science, he provides leadership, planning, and guidance to division management and staff on scientific policy, research methodology, and priorities for research activities. His work focuses primarily on the topics of youth violence and suicide prevention and the linkages across different forms of violence.
Hi everybody, good afternoon. Thank you so much for joining us today, and I want to thank the Coalition and Denny and Neil for hosting this briefing. This is an issue that's near and dear to me. It's a very important public health problem, and I'm excited to be able to talk to you about it today. When I first started working at the Centers for Disease Control and Prevention, this is the image that my family had of what I would be doing. And I think this is true for a lot of people. They think of scientists in biohazard suits working in labs or out in the field collecting samples. Very rarely do they think of violence as a public health problem, or that violence prevention is something that an agency like CDC would take on. But in fact, when you look at the top leading causes of death among adolescents and young adults in the United States, homicide is the third leading cause of death among those aged 10 to 24. And each year, it's responsible for more deaths than the next 7 leading causes of death combined. This means that every day in the United States, more than 12 young people are killed, and homicides are just the tip of the iceberg. Every day, 1,500 young people are treated in emergency departments across the United States for injuries resulting from assaults. And as we heard from the other panelists, violence affects all youth, but there are important disparities that need to be taken into consideration. We know that minority youth living in low-income urban communities are at significantly greater risk. So it's easy to, when we think about violence, to think about the injury consequences, the fractures, the lacerations. And many people also think about the mental health consequences in terms of post-traumatic stress disorder, increased risk for suicidal behavior among victims of violence. But people often don't think about the other, more indirect types of health consequences, including issues around reproductive health, like fetal death, unintended pregnancy, particularly associated with sexual violence and intimate partner violence. Also, issues around changes in high-risk behaviors like alcohol and drug use that are associated with trying to cope with the trauma that one's experienced, and the risk for infectious disease that can come as a result of those behaviors, or the risk for chronic disease that can come from those behaviors. As we heard from the other panelists, we're also increasingly becoming aware of changes in the physiologic response to stress that's associated with trauma, particularly early exposure to trauma, that can put victims at risk for chronic health problems like asthma, like stroke, like heart disease. So I want to also emphasize that in addition to health consequences, there's enormous financial costs associated with violence. It's really difficult to begin to quantify the financial costs. These estimates are just based on medical costs for caring for victims and lost productivity associated with victimization. And it puts the estimate for just youth violence from the incidents that happened in 1 year at $17 billion. It's hard to even imagine what $17 billion is. To help to put that in perspective, that's enough money to send over 250,000 young people through 4 years of college education. Huge costs associated with violence. So I want to start by emphasizing these consequences to highlight why it's so important that we look for the opportunity to take action now. The levels of youth in our country that are getting hurt and dying are just unacceptable. The impacts go far beyond violence to include other health consequences. They go even further, so you think about the levels of fear in some of our communities. National data from high school students indicate that 7% of high school students report having missed at least 1 day of school in the past 30 days because they felt too unsafe to go. So this means that there's a direct link between educational success and exposure to violence in communities. So clearly, youth violence hurts everyone, not just the youth directly involved, but also their families, businesses, schools, entire communities. There's multiple factors that contribute to risk for violence within communities. I want to illustrate this by sharing the story of Jason. Jason's a 12-year-old boy who's being raised by his mother who works 2 jobs to support him and his older brother. Because of the levels of violence in his school and in his community, Jason's older brother has taught him to strike first, to avoid being harassed, to avoid being disrespected. Jason and his friends have a reputation of being tough, and other students in school try to avoid them, as much as they can. But Jason doesn't always feel tough. Because of the violence that he's seen in school and what he hears about and sees in his community, he often has nightmares at night. He often has stomach aches that keep him up. In school, he's restless and has a difficult time concentrating. He's falling further and further behind. The school knows that violence is a real problem for the students that they serve, but they often aren't aware of what the options are or what the best opportunities are among the existing options. Jason's story illustrates that risk for violence really is an interaction between individual and family level factors and school level factors and community level factors. The public health approach to violence really emphasizes prevention, that is trying to stop violence before it starts so that children like Jason don't have to experience violence. The public health approach is a complement to the criminal justice approach and medical responses to violence. We're increasingly hearing from law enforcement leaders and community leaders that we can't arrest our way out of this problem, that we need to focus on prevention. We need to move upstream. We need public health at the table. At CDC, we focus on early prevention, trying to stem the flow of children moving into the criminal justice system, of children being treated in emergency departments. We do this by focusing on developing, evaluating, and then disseminating the most promising prevention strategies. And the field of youth violence prevention has learned a great deal in the past 3 decades from research and experience. We now have strategies that can be implemented with families, in schools, and in communities. And I want to share just a few examples and try to be as concrete as possible about each of these levels. So the first example is focused on very early prevention. And I wanted to describe child-parent centers. These comprehensive support services are intended for children in low-income neighborhoods, focused on children ages 3 to 9. So we're talking about a very young age. They include structured education, so it's pre-K as well as kindergarten for the children, as well as home visits, health screenings. They're able to address issues like speech therapy if it's needed. They provide connections to employment and mental health services for the parents. They also have an expectation that the parents of these young children will be involved in working with the centers on a volunteer basis, like 2.5 hours a week. So it's a significant time commitment from the parents. And what this does over time is it shows the commitment to the children of their parents in education. So the emphasis is on healthy development and educational success. And the results from Chicago, where this has been evaluated over a couple of decades, are just remarkable. They found 22% reductions in arrests for violent crime for children who've been participants in these centers through age 24. They've also found reductions in child abuse and neglect, youth substance use, and remarkable improvements in educational success and graduation rates. Recent cost-benefit analyses suggest that there's between $4 and $11 saved for every dollar spent. And this variability in this estimate depends on how early the child starts. If they started in pre-K, they're more likely to see the $11 saved. Now, the opportunities to work with families don't stop at a very young age. They continue across development. So I want to share another example. It's called Strengthening Families 10 to 14. This is a unique system in that they provide sessions that are specific to children, sessions for the adults, and then sessions that brings the entire family together. So with the parents, they focus on issues around the ability to manage one's emotions and to provide consistent and appropriate discipline to the children. With the children, they focus on a variety of problem-solving skills. And when they bring the family together, they provide support to the family as they work on resolving disputes and build family cohesion through a variety of different activities. Strengthening Families has been evaluated in multiple studies. It's been shown to reduce fighting by 32% and destructive behavior like property damage, etc., by 77%. And these are from kids who participated when they were in 6th grade, and now they're evaluated in 10th grade. So these were effects that were sustained across 4 years. It's estimated that it saves approximately $3.50 for every dollar spent. Now I'm going to move out and talk about school level. As other panelists have mentioned, there's a lot of prevention strategies that have been designed to be implemented in school to change how youth think and feel about violence and to change the climate within schools. Objective reviews of the literature on these universal school-based prevention strategies have determined that they're generally very effective and that the effects apply regardless of grade, regardless of race, ethnicity of the community that's being served, or regardless of socioeconomic status. One example that I want to mention that gets cited a lot is the Life Skills Training, or LST program. It provides a variety of decision-making skills and self-management skills that are listed on this slide. What I like about it is that the dosage of LST is pretty substantial. So kids are first exposed to this program that I'm thinking of in middle school in 6th grade, and then they receive booster sessions in 7th grade and 8th grade to reinforce the prevention messages. LST, the primary focus is actually on reducing youth substance abuse. But you can see how, you can imagine how these types of skills would apply across a variety of different outcomes. And that is in fact what they find. So evaluations have shown reductions in delinquency of 32% and frequent fighting in the past year of 26%, as well as lowered risk for tobacco, alcohol and drug use, risky sexual behavior, and even reductions in risky driving. So these life skills really do apply across a variety of different behaviors. The LST program is very inexpensive to implement, and because of the range of benefits that I've shown here, the estimates suggest that there's about $13 saved for every dollar spent on this program. So now I want to move out to the community level and just give one example here. I think there's enormous potential for community level youth violence prevention strategies. It's an area that at CDC is a primary factor in our new research agenda, trying to learn more. Because by intervening at the community level, we have an opportunity to change risk for the entire population. The example that I want to share comes out of Cardiff, Wales. Emergency department surgeon Jonathan Shepherd was sickened by the level of violence and the nature of the violence-related injuries that he was seeing in the emergency department. And he knew that most of these victims were never brought to the attention of law enforcement. So what he started was a process where upon admission to the emergency department, some very basic information was gathered. The time of day that the incident took place and the specific location, among other things. This information, what he did is he de-identified it, so it wasn't about solving individual cases, and he shared it in the aggregate with local law enforcement to complement the data that they already had about violence and assaults in the community. This was used to create more refined, more complete hotspot maps to guide targeted policing efforts. But then the partnership grew from there to include other community leaders, and they over time reflected on the patterns of violence that they were seeing in the city of Cardiff, and they came up with a range of other novel prevention strategies. So just to give you a couple of ideas of this, they noticed that there were fights on the metro platform when a platform got too crowded. So they worked with the Department of Transportation to change the schedule to reduce crowding on the platforms. At one period in time, they noticed that there was a dramatic increase in incidents of bricks being used as a weapon. So they sent somebody from the partnership out to the area of the community where this was happening, and it turns out that there was a lot of construction, and there were also a lot of bars. Well, what happened at night, people would get out of the bars, and there would be fights, and there were pallets of these bricks, and they would grab a brick and use it as a weapon. So they just passed an ordinance within the city, this is like a pump handle example, passed an ordinance that required that the pallets of building materials be secured at the end of the day, and the brick-related injuries went away. So novel strategies like that. We worked with Jonathan Shepherd and colleagues in the UK to evaluate this program, and using data that they had over a 4-year period, and we found that there was a 32% reduction in assaults and a 42% reduction in hospital admissions, and an estimated savings just in terms of criminal justice costs of about $19 for every dollar spent, because there were really very minimal costs associated with implementing this program. We're very interested in seeing whether we could replicate this in the United States. We think there's real potential here. The Department of Justice data indicate that over half of victims of violence do not report the incident to law enforcement. And we know that the gap in the United States is particularly high in some disenfranchised communities that are reluctant to disclose their victimization to law enforcement. So we're working with the Robert Wood Johnson Foundation, the CDC Foundation, University of Pennsylvania, and Jonathan Shepherd in the UK to try to adapt this model and replicate it in the United States. So I just want to summarize that what I've shared so far were just a few very specific examples because I wanted to be as concrete as possible and highlight the fact that these prevention strategies can have lasting benefits across multiple years, even decades, that they can extend across different types of violence as well as other health risks, and that there are some significant cost savings that can be gained from implementing these types of strategies. And also, that we can no longer say that we don't know what works. These strategies exist and they're available now. That said, there is an important gap between what the evidence suggests needs to be done and what's actually happening in communities. So to help bridge this gap at CDC, we're doing a variety of things. Recently, we released the documents that are over on the table here, Preventing Youth Violence, Opportunities for Action, and the companion document, Taking Action to Prevent Youth Violence. I hope you take a look at these. They're really intended to be a resource for decision makers within communities to help raise awareness about violence as a public health problem and the range of prevention strategies that are out there. And one of the resources that we highlight in these documents is the Strive Selector tool. This is an online interactive tool that contains about 50 evidence-based prevention strategies, and users can use the tool to enter very basic information like the age group that they're targeting or the risk factors that they're most interested in addressing, and it returns for them the prevention strategies that were designed to work with that population or to address those risks. This tool is part of our larger Strive initiative. It stands for Striving to Reduce Youth Violence Everywhere. And this includes resources like the Selector tool. We also have active technical assistance that we're providing to communities. We're supporting local public health departments, relatively modest amount of money, but the idea is to help them to serve as conveners and facilitators with their local communities to make informed decisions about these evidence-based strategies. We also have a great network. It's called the Strive Action Council, and it includes national partners from around the country, 18 actually, who are committed to addressing violence as a public health problem and working on prevention. So I'm almost done. I just want to end by highlighting the fact that not only is violence prevention the ethical thing to do to reduce injuries, deaths, and disparities among youth, it's also a strategic thing to do. And I say this because of the fact that violence is associated with so many other health consequences, that we've learned a great deal about what works to reduce youth violence and to improve positive, healthy behaviors, and that most of these strategies are, when evaluated for cost benefits, have been shown to result in substantial savings. So we've made a significant investment in our country in terms of research. We have a real opportunity to take advantage of the lessons that we've learned from that investment. So if you're interested in learning more about any of the data that I shared, the resources that I described, our research or our programs, please visit our website. Thank you again for this time today.